A very good evening to you all and welcome to the program. On tonight's Health Corner, we are going to discuss HIV, particularly some of the complications that are commonly associated with HIV. For a long time, we've not had a discussion on such an important topic, but tonight we are going to do so. I am Dr. Henry Dungu, and my special guest tonight is Dr. Aggrey Semere from the Infectious Disease Institute in Mulago. Welcome, Dr. Semere.
Thank you so much for having me. Good evening, viewers.
Indeed, viewers, we are going to discuss HIV, but not the whole of HIV. We are going to look at a condition called Kaposi's sarcoma. And, of course, a big name is a mouthful. But I believe by the end of the discussion, we'll be having a better understanding of what Kaposi's sarcoma is. Dr. Semere, let's go straight to the point. Kaposi's sarcoma, what is it?
Permit me to start this discussion with a bit of history. It has a way it teaches us quite a lot.
Okay.
Kaposi's sarcoma is actually a skin condition first described in the 1872 by some gentleman in Hungary. He was called Moritz Kaposi.
Moritz Kaposi.
He actually described something on the skin that he called a dark pigmented sarcoma, which means really something in the skin that is dark and looks like a bit of a swelling. And it took us a while to know exactly what this was. With that description, he was initially seen amongst these Hungarian Jews and the Mediterranean people. But truth to be said, it was also described here in Uganda in the 60s. I actually was surprised to learn that the old professors, the Chalwazis and the group that was doing a lot of work in the 60s and 70s in Mulago described this tumor amongst African men particularly.
Okay.
And to just move this further, it's a tumor in the skin or a cancer in the skin that is caused or that people get not because of anything, but actually they have an infection.
Okay. I guess when you get to understand the causes of this disease, but we still need to understand, when I'm giving that background, we are talking about HIV and Kaposi's sarcoma.
Right.
But you're talking about a disease that was described way back before HIV was described.
Right. It's good actually to give that preamble before HIV because I stopped in the 70s. Now, come the 80s, we actually have this. So what I want to say, it predated HIV. HIV, we started seeing it around the early 80s and mid 80s. HIV comes into the picture, and amongst gay men in the areas in the US, they described this cancer quite similar to what Kaposi and others have been describing.
But what they had seen in Hungary?
Yes.
But
this time it was actually more aggressive. It was being seen in areas it had never been seen before. In the lungs, in the intestines, in a lot of some of the lymph nodes, and it was very aggressive. And
so again, sorry to cut you short.
Yes,
you said it was being seen in the areas that were not the usual areas.
The body.
That one takes us to ask, what were the usual areas?
Yes. So previously, Kaposi had been seen in the lower limbs primarily, the legs, and it was a very slow growing skin swelling. It would sometimes look a bit like if you have seen elephantiasis. That one may be something that people have seen. And it wasn't so that painful, but it could cause some disability.
Okay.
And, someone would not really, apart from a few people in Africa, it would not really be a worrying cause of death because very few people are getting it. And we're really progressing that quickly to death. But come HIV, we got a variety that is rather aggressive. It can lead you to actually getting severe complication and dying within a very short period, usually even 3 to 6 months.
Okay.
Prior to this, even those who died would die actually within 3 years per se. So it was a newer, more aggressive condition. So with HIV, and that's coming in the 80s. And maybe can I move on to just explain why actually
Maybe
it
you do
became
that.
aggressive?
Maybe you do that.
As partly one thing we have to understand with Kaposi, it's a cancer that is thriving in this part of the world because of two important viruses that we have, very common in this part of the world. One, Henry talked about it, HIV. But there's another one, the Kaposi sarcoma herpes virus. Sometimes we refer to it as HHV8. These
No,
are
speaking those tough
yes, the herpes virus type 8. Don't worry, Kaposi sarcoma herpes virus. That virus is very common in this part of the world. Unknown to our people, it's actually about 40 to 50%. In fact, if you walk around here, so 40 to almost half of us actually have it in our bodies. But usually it doesn't give us problems if your immune system is functioning well. But if you have HIV, which actually thrives on depreciating your immune system, it actually gives a chance to this virus to actually cause havoc.
Okay.
And that havoc is what we see. I've seen some pictures being shown to you, is what we see as the swellings that show up starting from the eye, the nose, it actually likes the face for some reason, the mouth, the ears, all over the body. Primarily will be on the skin, but occasionally will go to the lungs and intestines, and eventually sometimes we see some of these tumors even in the lymph nodes.
Okay.
Yeah.
Well, for some of you have just joined in, you're watching Health Corner, and we are discussing one of the commonest cancers associated with HIV/AIDS. We have Dr. Aggrey Semere, who is an expert in this area and working with the Infectious Disease Institute, the College of Health Sciences, Mulago Hospital. Doctor, you are talking about the types. You know, sorry, I'm taking you back, and
no problem.
you talked about the original one before HIV.
Yes.
And then you
The
talked about the
HIV
one
one.
of HIV.
Right.
But for someone who is out there
Yes.
watching, they want to get this mental picture. We shall also get actually the images
Yes.
to see exactly the presentation. We are
Yes.
talking about tumors. Many of us don't know what tumors are.
Yeah.
But how does one say, okay, this person might be having Kaposi sarcoma? Presentation.
I'm going to ask the producer to run a bit
Let's
of
get
those
those pictures. But viewers, let me try to say this, that some of these pictures might be disturbing. Please take note of that.
Yeah. So as he runs the pictures, you can see that the first picture of a swelling on the nose. And the part that's actually, those are our friends in Uganda here. They also have, that friend of ours also had a swelling, other swellings in the face.
So those dark lesions,
Those
you see,
dark lesions, those dark swellings,
And the
in
cancer.
within, that is the cancerous lesion. Okay, we keep saying lesions,
Yeah.
but the cancerous cells in your skin.
to me they look purplish.
Well, the
or are
whites,
they black?
if you were like me, it will look purple.
Okay.
But if you're the common Ugandan, it actually looks almost dark brown.
Almost dark.
Almost dark brown too, or sometimes if it's early, it can look reddish.
Okay.
And yes,
Let's look at another image. and
yes,
see.
bring up the other images. So it can go to the eye, and that's what we call the conjunctiva,
So
the white
what-
part. That red, whatever you see in there that is red is actually the cancer. So sometimes you can see how subtle that looks. Nobody may actually think they have a cancer.
You can
in
think
the
it's a
eye.
red eye.
Yes, and you know, this red eye which is not going away for so long. But usually it will last longer than the usual red eye, and you notice that it is moving on.
Okay.
So then we have
Let me
other,
see if you have another image.
in
there.
the mouth,
Oh, that
it's
looks
so
like in the
common.
mouth, yeah.
On the roof of the mouth, we see that swelling that is coming down. And that is a very common place. That's where you may see the purple. That's where you may see the reddish, sometimes bleeding. Sometimes actually can see our friend they even lost some teeth. So sometimes you may not know why you're losing teeth.
Oh, look at that.
That may cause even pain when swallowing.
These actually look like nodular swelling.
Yes, those are now nodular. The nodule is really a swelling above the usual level of the skin that
It's
you
like
can
a coffee
touch.
bean or a pea sitting on
Yes.
this.
When you touch, you can imagine you can touch that. You touch something. So that's what we call a nodule in science.
Okay.
So again, on the tongue, we're having those swellings. They can make it. So if you actually examine yourself and see some of these things, it's our encouragement and the reason I came here to let you know that this is something treatable, and let your doctor know what you're having so that we can help you. Now this is a very subtle one where you just see red with mixed with purple
On the tongue.
on the tongue. You can see that may confuse you for sores or ulcers. And this is something I'm telling our doctors, that sometimes if you see this lasting more than the usual 3, 4, 5 days of the sores in the mouth, it's worthwhile taking or consulting somebody to take
Especially if someone is HIV
positive. Yes,
Okay.
truly so. Then we can move on to the reason I
look at
put
that.
this one there. It looks like a scar. It looks like you got an insect bite, but actually that is what we call a patch. You can even touch and may feel a slight swelling, but you see, if you see something like this and it has been there for a very long time and it's increasing, it doesn't. You know, if it's a scar, it will stay the same. But if it's abnormal, because it's a cancer, it will continue growing. Remember, it's painless. Okay.
I see. That's what I was going to ask.
Yes.
Are they painful?
And similarly, these are very subtle swellings, sometimes looking like scars, but you know where you had an injury. You can tell actually that I had an injury, so for sure I should expect a scar. But if you see a swelling that is coming out of the blue,
How about that?
now we are going to the fairly aggressive ones, and this is like in the area between the legs. For some reason, Kaposi likes some of these areas between the legs, and here we have nodules, patches. It's really a mixture, but you can see even the skin is swollen. It has that sort of orange peel-like swelling. It's full of fluid, and the
Like a
skin
skin of an
is
orange.
stretched, right? It is stretched, and that's not normal. If you feel that it's usually hard, our skins are generally soft. When you feel it hard and hardening and thickening, that is really telling you that there's something going on here. Don't wait for it to progress to that level. We can move on. The reason actually I brought the pictures is to help our people appreciate some of these subtleties, like that one on the ear. You can see how you can, say, well, you got bitten by a mosquito or something on your ear. But sometimes if you look at that person as a doctor, if you checked the rest of the other areas, you may find other lesions that are typical, the dark, swollen lesions or swellings. Again, these are the subtle ones on your skin. And part of the education that we give patients is to realize that if you see this, you see it growing, it's not going away, that is the time for you to ask for help. Let's sort this out. Now, this patient also had, you can see just those 3 lesions on the arm.
They look like beans.
They're like beans. They have that stretched appearance. They try to follow the skin of the what we call the tension lines in the skin.
Okay.
So they spread out flat, like we call it elliptical. They give that elliptical stretch-like shape when they go into the skin. Again, we can move on to see others. Now here we have this friend of ours with a combination. Up on the upper thigh, you can see the stretched, thick skin with a plaque, what we call a plaque, and that darkening that Kaposi initially described. But down, we can see now it has really evolved to even have some ulcers, some wounds. And this may need us to really investigate for cancer. So these are usually fairly sick people. By that time, you're really feeling pain and you can't even walk very well. Again, now this is another subtle one. It's a swelling on the thigh, and it's dark, it's swollen, it's a nodule. Yes, so there are some more, but generally these are the usual presentations we could expect. Yeah, thank you.
Wow, this is really highlighting, enlightening, because people are wondering, we are talking about Kaposi sarcoma, but I think now we all have a mental picture of what it is. And of course, if you've seen someone who has this, I think this would be the best time to know where to send them. Before we go for a break, you talked about the immune suppression associated Kaposi sarcoma.
Yes.
Does that mean that even without HIV, if your body system goes down, you can get this cancer?
Indeed, that's true. You know, now there are a lot of us who actually go for transplant.
What do you mean by that?
There are people who actually need a liver, who need a kidney. Commonly, we have seen kidney patients who have had a kidney transplant. Usually, they'll give you some medicines to try and make sure the body does not say no to the kidney.
Oh, I see.
And so those medicines really dampen the immune system. And for sure, that anything that would dampen the immune system, like those medicine in transplant patients, could actually predispose you to developing Kaposi. Yeah. And so it's something for them to look out for our patients and even for the clinicians taking care of these individuals.
Okay. Does Kaposi sarcoma affect a certain age group? Is it for only adults, or it can affect someone else?
Commonly it's seen in adults. Interesting enough, though not interesting to the patient, it actually affects men more than women.
More than women.
Yes. Children have been seen to get it, but only in the situation of HIV.
Okay.
About 2% of the patients are children. It's fairly rare.
Okay.
But generally we shall see it in the people in the middle ages, both male and female, primarily men. And we usually find that these men have a reduced immune system. We measure with the CD4s, and they have also the speed at which it will develop will also be tied up with their immune system largely.
Okay.
The weaker it is, the faster it progresses.
Now, Dr. Semeri,
Yes, sir.
we've seen those lesions. I know there's so many lesions that might look like that.
Oh, for sure.
How does one go about to confirm that this is actually Kaposi sarcoma? How do you make that diagnosis?
Yeah, that's for sure true. The first thing that will tell us whether this individual has Kaposi is, of course, when we talk to the patient. We'll be able to tell. This has been growing for this long, it's aggressive, it's in this area. But definitively, it's taking off the tissue, something we call a biopsy. What do you mean by a biopsy? Akanyama, of course. We take one of those lesions as you've seen it, and a piece of it is picked up and taken to a lab, and our specialists have a way of looking at these tissues within a microscope and telling us whether they are what they are, basically, because there are many things that can look like Kaposi. But Kaposi has a standard way it looks when you put it under a microscope.
Okay.
And sometimes we even use other things, stains and all the others on the
So
slide to tell.
to confirm that
yes,
this is Kaposi sarcoma,
we need to take
you have to take off a tissue.
something. Yes.
Isn't that dangerous?
For sure, it
people
may
fear
sound
that thing.
dangerous. Yes, sometimes, you know, it may sound dangerous, but we make it as comfortable as possible.
It's not painful.
It's not painful. We actually anesthetize the area.
You freeze.
We freeze it. We give you some medicine to nub it up, and then we use we have actually, traditionally we used to use to cut with a blade. No, right now we use a very nice round, we call it a 4mm needle, very like a punch. It just takes a little punch through the skin and picks it up. So you don't need knives, blades, or to look very complicated. You just pick it up in a nub area and you plug it, and it hardly bleeds at all.
You get
a very small piece of
you get a
tissue.
freezing agent.
Yes.
Then get this special gadget.
A special gadget.
And then you pick the sample.
We just pick it off the skin.
Does the patient have to be admitted for that?
No. You walk in and walk out. It can actually take you 15 minutes to have it done. It's like actually drawing blood.
Okay.
Even to make it more interesting, one of my colleagues recently documented this, but we are even teaching our lower cadre staff to do this. Actually, we primarily at my institute, it's well-trained nurses who are doing this. No longer a procedure that doctors do. So
I think Dr.
we can do
Semere,
it, but we have.
we'll go for a quick break. We'll take a quick break. When we come back, we'll continue our discussion on Kaposi sarcoma, including a clear understanding of how to take this diagnosis and how safe it is when we get back.